A 10-year-old patient sits in an examination room. He is in constant physical motion, struggling to maintain eye contact or hold his attention on a single task for more than a few seconds. His diagnostic markers point clearly to severe executive dysfunction. He exhibits behavioral disorganization and an inability to self-regulate that disrupts his daily learning. Now consider a 32-year-old adult male sitting in a fertility clinic. He is motionless, exhausted, and dealing with the psychological weight of idiopathic infertility. His lab results show a different set of markers: oligozoospermia, a severely low sperm count, paired with diminished levels of circulating testosterone. Oligozoospermia is a condition where a semen analysis identifies fewer than 15 million sperm per milliliter. These two patients are separated by decades of age, evaluated in entirely different medical disciplines, and present with completely distinct physical symptoms. Yet, despite the obvious differences in their diagnoses, both of these clinical presentations can originate from the exact same microscopic point of failure. That point of failure lies within the catecholamine synthesis pathway. The catecholamine synthesis pathway is the multi-step enzymatic process the body uses to manufacture dopamine, noradrenaline, and adrenaline. By examining two recent clinical studies, one in pediatrics and one in reproductive endocrinology, we can trace how nutrient availability at the very top of this assembly line dictates systemic disease throughout the body. Understanding this molecular pipeline requires us to look past the traditional boundaries separating neurological and endocrine disorders. The human body cannot absorb dopamine directly from the food we eat. Every molecule of dopamine required for brain function or hormone regulation must be manufactured endogenously inside your own cells. The raw material is the amino acid L-tyrosine. To become dopamine, it passes a bottleneck controlled by tyrosine hydroxylase. This enzyme requires elemental iron to work. With iron, it synthesizes L-dopa, dopamine, noradrenaline, and adrenaline. If iron runs out, the entire pipeline stops. This blockage restricts the availability of dopamine across all physiological systems simultaneously. A minor mineral deficiency creates a severe biochemical bottleneck, starving the entire human body of essential regulatory neurotransmitters. We can observe the first consequence of this bottleneck in the brain, specifically within the prefrontal striatal networks. These specific neural pathways handle executive function, the ability to plan, the ability to focus, and to inhibit impulses. These networks require a constant high-volume supply of dopamine and noradrenaline. In patients with ADHD, pathophysiology is defined by diminished dopaminergic tone in these exact regions. Their networks lack the neurotransmitters required to sustain attention. A study published in the Journal of Pediatric Research investigated this mechanism by measuring iron levels in children clinically diagnosed with ADHD. This scatter plot shows a significant negative correlation between systemic iron levels and hyperactive symptoms. As iron drops, hyperactive behavior increases. A second chart shows the correlation between stored ferritin and attention deficit severity. Now, follow that exact same dopamine deficit out of the brain's cognitive centers and down toward the body's systemic hormone regulators. Human reproduction is controlled by the hypothalamus-pituitary-gonadal axis, or HPG axis. It is a coordinated endocrine system where the hypothalamus, pituitary gland, and gonads interact to regulate development and reproduction. Here, dopamine acts as the primary prolactin inhibiting factor. Dopamine physically binds to the anterior pituitary gland, acting as a blockade to prevent the release of the hormone prolactin. When the synthesis bottleneck causes dopamine levels to drop, that physical blockade is lifted. Without the dopamine brakes, a massive wave of prolactin floods into the bloodstream. High levels of circulating prolactin aggressively suppress gonadotropin-releasing hormone, triggering a downstream crash. This forces a severe drop in luteinizing hormone and follicle-stimulating hormone, which stimulate testosterone production. Without LH and FSH, the testes shut down, testosterone production plummets, and the creation of new sperm halts. A dopamine deficit disrupts cognitive regulation while simultaneously triggering the chemical cascade that suppresses the reproductive system. To prove this mechanism, a clinical trial published in Fertility and Sterility tested an intervention on infertile men. They used the seeds of a plant called Mucuna pruriens. This specific plant possesses a unique biochemical property. Its seeds are densely packed with naturally occurring L-dopa. Administering L-DOPA is a strategic biochemical bypass. It enters the synthesis pipeline exactly one step after the iron bottleneck. The downstream pipeline immediately reactivates, flooding the system with fresh dopamine, noradrenaline, and adrenaline. This comparative bar chart illustrates the clinical trial results. By restoring dopamine, prolactin was suppressed back to normal ranges. Consequently, serum testosterone increased by 39% in the oligozoospermic patients. With prolactin suppressed, the brakes were off the reproductive system, allowing LH and FSH levels to rebound. This chart shows the final reproductive outcome, a 576% increase in sperm concentration. This total recovery was achieved without administering synthetic testosterone or traditional fertility drugs. By bypassing a single broken enzymatic step, researchers reactivated a dormant male reproductive axis from the top down. The data from these studies provides a clear biological lesson. Neurotransmitters do not respect artificial medical specialty boundaries. Dopamine maintains a dual identity. In the brain, it is a neuromodulator, keeping your attention stable. In the bloodstream, it is an endocrine inhibitory factor, keeping your hormone production balanced. Traditional medicine separates these conditions, treating ADHD with stimulants and infertility with hormones. However, tracing this shared biochemical pathway reveals that both conditions can arise from the same upstream failure. Treating complex multi-system phenotypes requires physicians to look upstream at these metabolic pipelines, rather than treating isolated symptoms downstream. The total health of these systems is dictated by simple biological precursors, like the elemental iron needed to run an enzyme, or the plant-derived L-DOPA used to bypass it. The hyperactive 10-year-old and the infertile 32-year-old are victims of the exact same biochemical starvation. The functional state of our most complex cognitive and reproductive capabilities relies entirely on the output of this singular, delicate assembly line.